have been looking forward to this. We're back with our new series. It's called CEO of Your Health, all about investing in your health the way a CEO invests in their company. According to the Kaiser Family Foundation, 1 in 3 women reported that they had a negative experience during a healthcare visit during the last 2 years. Dr. Narula is back to help you feel prepared and confident for your next doctor's visit. We have been working on this and so very excited about it. Why is it more important than ever that we're doing this?
Robin, our health is our greatest asset, and we really want people to start thinking about the same way that you invest in your wealth, you need to invest in your health. I was a small business owner. Anybody who's owned a business, you know it takes time, energy, hard work, perseverance, patience, research, all those things that you pour into your company to make it a success. You have to pour that into your health. Those preventive visits, the screenings, it's going to pay off over time in terms of both longevity, but most importantly, quality of life. Everybody wants to feel good and have good quality of life.
I hope everybody's on the edge of their seats right now, because what we're going to do is walk people through it, okay? If you have a doctor's appointment coming up, there are things you should be doing right now. So give us our doctor's orders.
Yeah, so you want to be so prepared because you really only have like 15 to 45 minutes with the doctor. So the first thing you want to do is research the credentials of the physician you're going to be seeing. You want to know maybe where they trained, but most importantly, what their specialty is. So just because I'm a cardiologist, we all specialize or have different niches. So there might be somebody who deals with heart failure versus the electrical system. The same with gastroenterology, maybe someone that specializes in GI cancers versus inflammatory bowel disease. Know your problem and know the right person to see. You want to know, is that person a private practice? Are they affiliated with a health system? What kind of a practice do you want to be joining? And then you want to know location. So a lot of times you pick a location that may be far away, you won't be able to keep those visits. So make sure you pick a place that you're actually going to be able to go to. Okay, then when you're ready to go to your visit, you want to make sure you show up on time. Some places will cancel your visit if you are 15 minutes late. You also want to show up hydrated. Lots of times you're going to have your blood drawn, and I have patients say, my veins are disappearing. Make sure you...
Yeah, I'm one of those.
Exactly.
Yeah.
Make sure you've drank enough water, and then fill out your forms ahead of time. A lot of times I'll see patients in the office and I'm trying to take their history and they're still writing down and you're not connecting with them. So try to get ahead of that before you even show up into the doctor's office. Because that's important. The next thing you want to do is gather all of your health records. So you want to make sure you have your previous labs, your blood work, your imaging, even the discs. Lots of times the physicians want to see the actual images. And then a really good tip is write down on a piece of paper your prior medical history, surgical history, when that happened, your family history. All of that data is going to be really helpful to present the physician, and a list of your other healthcare providers and their phone numbers.
I take a picture of my medication because I can never remember the names of it. So I take a little photo of it so that way I can share that information. Okay, so now we're in the doctor's office.
Yes.
What is our priority once we're in the appointment?
So the medication is a great one. I'm glad you mentioned that, because I was going to say the same thing. Either bring your bottles in or bring pictures of your bottles. You want to keep a symptom journal. So doctors are going to ask you, when did your symptoms start? How long have you been having them? What does it feel like? That information is really helpful. And lots of times you forget, has this been going on for 1 month or 3 months? So you want to make sure you write that down.
Okay.
Bring a phone or an iPad that has access and a login to your portal. Lots of times people have, labs from another institution and they say, I don't remember my password. Make sure you have that. Bring paper and a pen so you can keep notes. Many times you forget what someone's telling you. The information's coming in really fast. And sometimes bring a friend. A lot of people like bringing their partner or a friend to really help them remember what's happening in the visit, or even ask questions and advocate for them.
This is a tough question for some people, and it was even one for me because I had to make a switch. How do you know when it's just not a good fit? The doctor isn't a good fit for you.
This is the most important question, in fact, in that very first visit, really, is that sense, that intuition. Do I connect with this person? Are they making eye contact with me? Are they listening to me? Are they asking me questions? This is a relationship. You're in a gown, you're naked, you're vulnerable, you're telling them your most private things. You want to feel that you can trust this person and that you like them, because they're going to be on your journey with you. So really important to have that relationship and feel comfortable.
And to know you have the right to make that decision.
And to say no.
And it just means like it's not the right fit for you.
Correct.
Not saying that they're not a good doctor or whatever, but it's not for you.
Which we're going to talk about tomorrow.
Oh, look, she keeps like just segueing, promoting herself for tomorrow. I love this. Thank you, Dr. Narula. And you can scan the QR code on your screen to get Dr. Narula's checklist for being the CEO of your health. Think about that. You are the CEO of your health. And tomorrow for our series, we'll be talking about how to advocate for yourself as a patient.